If we look at that cohort, 2 persons positive out of 14,222, it means that 99.986% of them did not develop COVID upon entry into the country, at least that we are not aware. It is an extremely small percentage of people to change the policy for.
Chief Medical Officer Dr. Roshan Parasram is defending entry protocols into this country, saying there's been a very small percentage of fully vaccinated people testing positive for the virus. The 2 vaccinated individuals who had the virus also tested positive for the Delta variant, but Dr. Parasram says one of them would have undergone some form of quarantine since that person is involved in the energy industry and was in quarantine prior to being deployed offshore, and says that person's 8 contacts have since tested negative for the virus. The other vaccinated person, though, would have been able to go straight home, where they developed symptoms, and 4 close contacts have been identified. However, Dr. Parasram says although there's no requirement to isolate upon return, vaccinated people should still do so as a precaution.
They had that person coming in, going home, and doing exactly what we are asking people to do. Have that level of personal responsibility, quarantining yourself to some extent, making sure you minimize your contact. And of course, as soon as he got symptoms, he would have tested, which is really what we want.
Dr. Parasram says based on a minuscule percentage of vaccinated people testing positive, it does not warrant a more stringent measure of quarantine.
Now that we have 2 out of 14,000 people being positive, builds the case to not have a punitive measure of quarantine of 14 days or otherwise for that small, extremely small subset of people, where you have 99% of people having to pay the price for an extremely small proportion of possibility of COVID.
Dr. Parasram also believes the mandatory PCR test requirement 72 hours prior would have also contributed to an even lower number of positive cases entering this country. Sunil Lalla, TTT News.